Thank you for visiting the National Center for Medical Home Implementation website. This tutorial will give you a quick introduction on how to navigate the site and the resources available to pediatric healthcare professionals, families, and all others who want to ensure that every child and youth has access to a medical home. The home page features a description of the family-centered medical home approach to care, quick links to key resources, a link to sign up for the Medical Homes at Work e-newsletter, a What's New section that presents the most up-to-date medical home resources and information, and a link to the National Center's Facebook page. The main navigation bar across the top of the page presents the site's content framed around 6 main areas: About Us, How to Implement, Training, State Pages, National Initiatives, and For Families. The About Us section includes an overview of the National Center, as well as literature and media resources that provide a clearer understanding of the family-centered medical home. This section also links to current and archived issues of the National Center's monthly Medical Homes at Work e-newsletter. To register to receive the e-newsletter, click on the e-news sign-up link at the top of each page of the site. The National Center also publishes quarterly Spotlight on Child Health Issues. Each edition describes a specific health issue in the context of the medical home. Topics include oral health, transitioning from pediatric to an adult medical home, and disaster preparedness. The How to Implement section of the site is divided into 6 core medical home functions and includes practical and downloadable tools for pediatric providers, as well as examples of promising practices that have been implemented in offices around the country. A medical home provides patient and family-centered care through a trusting, collaborative, working partnership with families, respecting their diversity and recognizing that they are the constant in a child's life. The Care Partnership Support section addresses patient and family access to care and provides specific strategies to enhance communication and partnership between providers, families, and patients. Providing a high-quality medical home is most successful when a practice has well-organized patient medical records and easy access to clinical guidelines. The Clinical Care Information and Organization section provides tools to enhance record keeping and resources for the delivery of efficient, evidence-based clinical care and patient self-management support. The medical home is an integral part of the community-based system, a coordinated network of services designed to promote the well-being of children and their families. The medical home works with a coordinated team, provides ongoing primary care, and facilitates access to a broad range of specialty community services. The Care Delivery Management section describes how a practice can deliver coordinated clinical care that addresses patient and family needs and preferences across the preventative, acute, and chronic care spectrum. For a medical home to function well, it is important for primary care providers to be aware of and have linkages to high-quality community resources for their patients. The Resources and Linkages section includes key national and state organizations, as well as practical tools and sample guides. Collecting data on clinical performance and sharing it with practice staff, patients, and families can help improve a practice's ability to be an effective medical home. The Practice Performance Measurement section provides tools and strategies to help a practice organize and measure the quality of care they provide, including physician and practice team performance, as well as patient and family satisfaction. Matching quality care with appropriate payment is an important piece of medical home implementation. The Payment and Finance section includes coding fact sheets, promising practices, funding opportunities, as well as other tools that can help a practice negotiate appropriate payment for medical home-related care services. The next section of the site is the Training section, which includes continuing medical education opportunities, upcoming conferences, events, and webinars related to medical home, as well as educational resources for medical students and residents. This section also hosts archived versions of the National Center's 2009 and 2011 Medical Home Implementation webinar series. These 9 webinars feature recognized experts discussing the value of the family-centered primary care medical home across the spectrum of care for all children and youth. The State Pages section of the site allows visitors to find out what is available and occurring in each state regarding medical home. Each state page includes a wealth of current information on state pediatric medical home projects and programs, key partners, and useful child health data. The National Initiatives pages lay out the medical home initiatives occurring across the country, including the American Academy of Pediatrics Medical Home Chapter Champions Program on Asthma, Medical Home Recognition and Accreditation Programs, and multi-payer pilot programs that test and measure the medical home model. The For Families section of the site features links to tools and resources that help families partner with their care. Resources in this section include care plan templates, preventive care tools from the AAP Bright Futures program, community and state resources in English and Spanish, and a link to healthychildren.org, the official website for parents from the American Academy of Pediatrics. As you continue your work implementing the medical home model, we hope that the National Center website and its regularly updated resources will be of continued use to you, whether it be in identifying demonstration projects currently underway in your community, contact information for key partners you may want to work with, or practical tools that you can download and start using today. If you would like additional information, please utilize the Contact Us page on the site. Our technical assistance staff is available by phone or email to assist you.